Okay, well, it's 10 o'clock. We'll kick off to the latest in our series of Spotlight on Stigma webinars, and we're focusing on hepatitis B today. Before we start, I'll acknowledge that I'm on the lands of the Bidjigal people of the Eora Nation, and I pay respects to elders past and present. Acknowledge any Aboriginal and Torres Strait Islander colleagues who are joining us on the call today, and also acknowledge that wherever we are across Australia, we're on unceded Aboriginal land. So we're going to be talking hepatitis B today with a fantastic range of experts in the field. So we have some international guests with us from the Hepatitis B Foundation in Australia. So I'll just get Chari, Cohen and Yasmin, Ibrahim just to wave for the moment to let everyone know who you are. And we're also joined with one of our national experts, Associate Professor Thomas Tu from Sydney University, Westmead Institute for Medical Research, and founder and director of hepbcommunity.org. So a really focused discussion on hepatitis B. We're going to kick off with Chari's walking through some of the work they've been doing in the US from the Hep B Foundation. And then Yasmin can join in, and Thomas has some content to talk about as well. And then we'll have some Q&A discussion towards the end of the hour. So without further ado, I'm going to introduce Chari Cohen, who's president of the Hep B Foundation. That foundation's a non-profit org dedicated to finding a cure and improving the lives of those affected by Hep B across the world. Chari's work focuses on improving access to screening, vaccination, care and treatment, addressing stigma and discrimination, what we're talking about today, and reducing health disparities associated with Hep B and liver cancer. So very warm welcome to you, Chari. Over to you.
Thank you so much. I'm very happy to be here and much appreciate the invitation. Happy to talk a little bit about hepatitis B. I'm going to talk a little bit about what we do with Hepatitis B Foundation and then kind of move over into stigma and patient experience. And I'm delighted to have Yasmin Ibrahim here, who probably knows, she probably should be doing this, but she'll be able to fill in any gaps that anything I missed. So I'm going to go ahead and I always have too many things open so that my screen never wants to share. There we go. Okay, so from beginning, there we go. Can you guys see that?
Great, good.
Perfect. Okay. We're going to talk about working in the community towards addressing hepatitis B, and I'll get started. I'm not going to spend too much time. Carla, will you send these slides out to folks after?
Yep, definitely.
Perfect. So I won't spend too much time on us, but we're a national nonprofit organization. I actually think we're still the only organization worldwide who only focuses on people living with Hep B. So the only thing we do is hepatitis B and liver cancer and hepatitis delta as well. And we work in multiple different realms. As Carla said, we're based in the United States, and we do have local and regional and national programs. We also have international programs, and we are working basically to find a cure and improve the lives of everybody living with Hep B. That's 300 million people worldwide. So it impacts quite a lot of people. And we do this through education, outreach, public health. We design public health interventions and strategies to get people tested and into care. We work with patients and communities to help represent their voice. And we do quite a lot of policy work as well. And just to mention, we also do have a research institute in our building where we have a bunch of basic scientists, virologists, immunologists, and chemists who are working on drug discovery for a cure. And Yasmin and I can probably talk a little bit about that, but we mostly can talk about the public health and the awareness aspects of it. So as I said, we are working for 296 million people worldwide who are at high risk for developing serious liver disease because of a hepatitis B infection. And I don't know, who knows about hepatitis B, but it is a virus that impacts the liver. And most people around the world are infected at birth because of the blood exchange that happens during delivery. So mother-child transmission, and unfortunately are put at greater risk for liver cancer later in life. the important thing is there's so much we can do about it. We can not only vaccination, which prevents people from getting infected in the first place, but we have really good antiviral treatments that help keep the virus under control and can help prevent liver damage and liver cancer. But the key to getting people into care and making sure they get the treatment they need is screening and linkage to care. And that's where we see major gaps. Across the world, people are living with hepatitis B who don't know it, and often they're underrepresented communities who have limited access to healthcare. And that's sort of separate from the whole fact that hepatitis B as an infection and as a disease itself is stigmatized, and people often face discrimination who have hepatitis B. And so there are a lot of reasons why people aren't getting tested and aren't getting into care. And it's our job to move the needle on that forward. So this is just a very loud slide of what we do. But most of what we do, I think the thread here is partnership. We work with partners around the country and around the world to try and find better ways to reach communities that are highly impacted with hepatitis B. You know, we know a lot about Hep B and liver cancer. I don't know the communities, right? I'm not in the communities. And so if you want to make a change in communities, you have to work with the people who are the trusted community leaders. And that's what we do. We try and support people on the ground to help them do work in hepatitis B and help get people tested and into care. But we also do quite a lot of education and awareness. We reach about 4 million people a year. Our website is pretty interactive. It's in 16 languages. We also have a podcast and a blog and lots of social media, and we try and come up with new and creative ways to get people to talk about hepatitis B and to get people tested and into care. And a lot of what we do is focused on addressing stigma. One of the things that's a little bit unique that we do is consult. So we have a patient helpline, a consult line where we talk to about 10,000 people a year who are living with hepatitis B. And the really wonderful thing about that is that it helps us to learn what's going on in the world and what are the biggest issues facing people living with Hep B. That's how we learned about stigma and discrimination, because people would call us and say, I tested positive for Hep B and lost my job, or and my husband left me, or I'm isolated now and I'm afraid to tell my friends. And so in those kinds of interactions, what we learned was that there's a whole hidden aspect of living with hepatitis B that nobody was talking about. And so we decided to address it in a number of ways. And one thing we did was started a formal program to document the lived experience of people with hepatitis B. And so we worked with the FDA to host a patient voice meeting. It's sort of a patient-focused drug development meeting that we had. And that the goal of that meeting in 2020 was to start documenting what it means to live with hepatitis B, so that we can really learn from people who have Hep B and understand their stories and what they want and what they need. And stigma and discrimination were a big part of that. But we also started to uncover issues with testing and treatment, and physical pain and social isolation. And so we're really finally starting to learn about Hep B and hopefully then able to meet needs better. The other thing that we learned was that was the power of storytelling. And I'm going to talk a little bit about that as a strategy to help overcome some of the gaps and the barriers that we're seeing. So we're learning, you know, what are the major public health challenges? And I know the list looks long if you look at this slide. Of course, there are multiple challenges to addressing and eliminating hepatitis B, and you can see discriminatory policies and stigma are here, of course, but there are challenges at every step of the way, right? So individual level challenges, community challenges, systemic level challenges at a global level. And I think, you know, low awareness is part of the problem. One of the things we also know is that low prioritization is part of the problem. I mean, to me, it's amazing to see people's faces when you say 300 million people have hepatitis B and about 900,000 people die of Hep B related disease each year, and they're shocked. Why don't we talk about it more? Well, I don't know. I wish it's hard to understand why it's such an under prioritized disease. But what we're learning is that if we want to move the needle and we want to make it more prioritized, we need to work with people who are impacted and get the word out, sort of start screaming from the rooftops. And that's been really hard to do because of the stigma to some extent. and because people are not often diagnosed. So, you know, at the level of people living with hepatitis B, we see quite a lot of personal challenges as well. And what we've learned at this point from talking to, you know, numbers of thousands of people with Hep B over the last few years is that limited access to care is an issue. It's not an issue everywhere. It's not the same level of challenge everywhere in the world, but almost everywhere there is some challenge to sustainable care and treatment for hepatitis B, including surveillance for liver cancer. We also are starting to better understand and document the quality of life impact. You know, and I'm embarrassed to say it, but something we have always said, because we want people to know that it can be a silent disease so that they take care of themselves and maybe to prompt them to get care. But we've been saying hepatitis B is a silent infection for years. Hepatitis B is not a silent infection. People are way more impacted. They just don't let on, right? And so what we're learning by talking to people is they do have physical symptoms. And if they don't have physical symptoms, they are feeling the psychological, social, emotional, professional, they are feeling the impacts in other ways. It's really not a silent disease. And I want to stop, I want to stop saying that because people are impacted at every point of their life when they have hepatitis B. So what can we do about it? Well, like I said, I think the key here is we need to start demanding change. We need to work together to create, you know, a multi-sectoral movement, and we need to help people understand the role they play. Otherwise, we're not going to increase global prioritization. You know, if you think about the groups that have been able to make movement, to make change, they're loud. You know, the breast cancer awareness group, the HIV groups, they get together, they organize, you know, they shout as loud as they can, and they make change happen. And that's kind of where we need to go. And it's what we've been doing. And I think there are people around the world that are starting to do this. And I think we're at an inflection point, because so I've been doing this for about 22 years. And really, it's just in the last 3 years that we're seeing a change here. And I do think we're at a place where we can really, really make a difference. And one of the strategies we can use, which we're starting to see is very effective tool, is storytelling. This is not new, right? We use storytelling, every culture, every group in public health, we've always used storytelling. I will say for a number of years, we tried to start a storytelling program at the Hepatitis B Foundation. We were unsuccessful for many years because it's really hard. It had been really hard to find people who wanted to come out and talk about their hepatitis B, and the stigma had something to do with that. And we kept trying, and I don't know what changed, but in 2015, the stars aligned, and we were able to start a storytelling program, and we were able to recruit our first 10 storytellers at the time. And we realized that we wanted to, you know, I think at the time we didn't realize actually what we could do with it. We didn't realize how big it could get, but storytelling is a really valuable tool in public health. You can use it to educate, but you can also use it to make change happen. You can use it to change people's knowledge, but you can also use it to change how people feel and what you might be able to prompt people to do. And so we have been using our storytelling program, which is both US and international, to raise awareness about Hep B, to put a face on hepatitis B and liver cancer, and to try and address the issues surrounding stigma and discrimination. And the goal here is to get people talking, because if you see someone talking about hepatitis B, you'll share it, and then maybe you'll be prompted to talk about Hep B, or you'll talk to someone else about it, and maybe they'll be prompted to talk about hepatitis B. So here, we're really just trying to move the conversation forward and empower people to make change and to take some action. So I will say I'll go back to this slide. So after, gosh, it's been, since 2015, so 7 years, we now have 50 storytellers who have made a total of 50 or 51 videos. Some of them have, a couple of them have more videos than one because they're in multiple languages. And each video is about 3 minutes long. I'm going to show one in a little bit, but each video is different. We have diverse storytellers from, at this point, a number of different countries in different languages, representing different cultures, and also representing a different part of the hepatitis B experience. Some people talk about liver cancer. Some people talk about losing a parent. Some people talk about being young with Hep B and having to date. Some people talk about drug use or experiences they had with doctors and healthcare providers. And so what we're hoping is that with enough stories, there will be something that resonates with everyone. And the videos have been viewed about 4 million times online. So as I said, we also do public health work, and one of the things we wanted to make sure is that we weren't just throwing out a campaign. We wanted to see what kind of impact it might be having. So we do evaluation to see what kind of impact the story has. We've done a bunch of different kinds of evaluation. The first one we did was we actually did an evaluation on the storytellers themselves. I'm not going to talk about those results today. I'm happy to follow up on that, but I will say the evaluation we did showed we made that just becoming a storyteller actually impacted people's lives. It was really quite fascinating to see. But I will say we have been studying the impact of the videos to see what kind of impact they're having on the viewers. And one of the things we wanted to look at was the impact of story type and the impact of story narrative. So we did a couple of online surveys. We usually do our surveys using Qualtrics. And we work with partners at Caltech University in California to do this. It's really nice to have academic partners to work with. And what we found after showing a number of different videos and comparing them were two things. One, parental stories had a higher, so people perceived hepatitis B to be more severe if we had intergenerational stories. So mothers talking about kids or kids talking about parents. We also saw that young adult stories scored significantly higher. People wanted to see young people, and that was a little bit of a surprise, but for most of the people they scored better. They just scored higher. And then I highlighted here in green that informational videos had higher messages. So we compared our storytelling videos with some informational videos that were not storytelling, and the viewers in the study rated the informational videos as having more credibility. So while the storytelling videos were creating an emotional impact on people, it was affecting them emotionally on the viewers, it wasn't necessarily, they didn't necessarily think they were credible. And so what we learned from that was we had to change our videos. And so we actually created a bunch of informational messages about hepatitis B, and we tailor those messages to the kind of video, to the video itself. We have gone back to all 50 videos at this point and put informational messages throughout those videos. So now we have the story, plus we have information. You know, this is what Hep B is, perhaps this is how it's transmitted, this is what you could do about it. And so now we're actually in the process of testing those because those have been out there for a little while now. The other thing we tested was video length, and that's something that's interesting with, especially as these are really mostly seen online, and they're about 3 minutes long. So we did test some of our videos full length and shortened length. And as it turns out, primarily people liked the longer one. I was pretty surprised about that, but the longer, the full 3 minute videos did score higher. However, there were still some benefit in shortening some of the videos, and a lot of people felt that they would be viewed to the end. So a lot of times we share these videos on social media, and people aren't necessarily motivated to stay for 3 minutes, and so those shortened videos do have a place for us. So if you are okay with it, let me see if I can get this to play. So this is Shell's story. Shell is a new storyteller. We have been able to host one in-person storytelling workshop since the pandemic, and Shell was part of that. So let's see. Nope. Okay, I'm gonna rewind. Okay.
As I bared my arm for the tourniquet, I felt good about being part of the military blood drive. It was 1984, I was 18, doing my first year of service. A few days later, I was pulled into a medical appointment. The doctor asked me to sit down and said, "You have hepatitis B." I was stationed in England when they removed me from the medical field, a career I had always wanted. Instead, I was put into a supply career where I couldn't infect anyone. I was treated like one big walking infection that no one would touch. I went to get my teeth cleaned, and the dentist double-gloved, masked, wore a gown, and covered all the lights and tools with plastic. I felt so isolated, I couldn't even talk to my family. They were all back home in the US. When I thought of them, sometimes I thought about all the stomach problems I had complained of as a kid. I had been adopted from the Philippines in the 1970s. I was tested for this and that, but not for hepatitis B. Testing for the virus wasn't widespread at that time. I was called a hypochondriac when the doctors couldn't figure out what was wrong. 4 years after I found out I have the virus, I gave birth to a son. Because he had oxygen deprivation and jaundice, the idea of mother-to-child transmission came up. The doctors wouldn't let me see him or hold him for 2 days. Stigma, lack of knowledge of the disease, not knowing what to expect. This is how it went for decades. 35 years later, I'm working in the medical field again. When I was thinking about going back to school to be a physician assistant, I asked a professor, "Can I even be a provider living with this?" He said, "Of course you can." Things had changed. It still haunts me to remember how I was treated. It was so taboo. Now we know better. Just be well informed.
Okay, so it's a great video. Thank you for watching. And I will say, you can see at the end those 2 slides, those informational slides. That's what I'm talking about. Those are new. They used to not be part of the program. And Shell, you know, in the end, she was lucky because she went to a school where they knew what the protocol was, and they said, of course you can be a provider. That doesn't happen everywhere, by the way. Some people are told no. They're told, no, you can't be a healthcare provider, or you shouldn't be a healthcare provider. So there's still quite a lot of work to be done. And with that, I am gonna stop talking, but I will say the one thing we have learned over the last number of years is that in order to address stigma and discrimination, we need to talk about it. I think for a long time in public health, the feeling was that education would address stigma, that if you just give people the right knowledge, that they will be fine and stigma will go away and everyone will talk about a disease. It doesn't work that way. Education is not enough. You need to change. You need a lot more than just, you know, fact campaigns. That's important, of course, but you kind of need a multi-pronged approach, which is what we're trying to do. And hopefully over the next number of years, we'll be able to see some changes. And I do have a couple of resources here in case people want to get involved. Thank you.
Great, thanks so much. And we've put a couple of things in the chat too of your work, Chari, because I found some of your papers about the storytelling and loved them so much and thought we could be doing some great things here. So that was part of the reason to reach out to you. And I want to introduce properly Dr. Yasmin Ibrahim, who also works at the Hep B Foundation. And I just reread your bio, Yasmin, with the knowledge now about that consult line. So you do nearly 2,500 email consults around the globe with people living with Hep B. So is there anything you haven't heard or haven't come across in that enormous amount of contact you are having with people living with hepatitis B?
Not really. I think they send us everything, and surprisingly, actually, sometimes we wouldn't expect like the questions and or I wouldn't expect sometimes the question and information they share. And sometimes when I respond back and I ask them, have you talked about this with your family or with and they say no. I mean, and sometimes up front when they ask, they say, we've been looking for information. We can't talk about this with anyone. We don't know even if this email will find a response, and they are so, and then they are so pleased and happy when they receive a reply. I think this goes back to the point of stigma and isolation. It's there's a lot of community and society isolation, but there is also self-isolation, and people end up they find themselves at the end sending an email that's more comfortable than confronting a person or talking even to a relative or a loved one or a friend, because they can break that barrier and talk to someone.
Great. I'm sure there'll be lots more to pull out in discussion. So I'm going to hand over now to Thomas too, as I mentioned up top, microbiologist, but also fantastic community advocate and member of the community. So Thomas, over to you.
Thanks a lot, Carla. I'm just going to share my slide. And thanks to Chari and Yasmin for giving a great insight. And I really respect and obviously have known about the Hepatitis B Foundation for a long time. First in my sort of position as a molecular biologist in the Hep B field, they organised the International Hep B meeting, but also now a lot more with the patient advocacy side. So I'll be talking about engaging the Hep B affected community in Australia and what we're doing. So this is all about patient-focused needs and challenges. I've stolen this slide off Chari. So just a bit of background. I was diagnosed as a 15-year-old. I went through a lot of the issues that we're talking about. First, that overwhelming sort of emotional weight of the diagnosis, and then also the stigma and discrimination, at least in my mind, associated with that. And it made me basically ignore the condition. And that would have continued if I hadn't, done a PhD in Hep B and understand this is actually a serious condition and I can do something about it. So what we're talking about here is that stigma and discrimination and isolation is really important in terms of access to care. And really, as Chari said before, that Hep B is clinically silent for most of an infection. So that stigma and isolation and those emotional aspects are the main issues that affect people in the Hep B affected community. It isn't necessarily a physical symptom. Chari went through the whole group of things that the Hep B Foundation is doing, and it's amazing. But here in Australia, what can we do if we don't have those decades of coordinated infrastructure development? What can we do if we don't have that capacity and resourcing? I just went through very quickly your annual report, and it's $8 million of income every year. Is that right, Chari? That's
so it's 6 million is for the Blumberg Institute. That's the basic science. So the foundation and the HBV meeting is about $500,000. So the foundation is about $1.5 million a year.
Yeah, but still great. I mean, a huge amount of capacity and resourcing, outstanding international advocacy in the Hep B space. But what if you don't have that patience for society to change? That change in stigma and attitudes towards people with Hep B, they take time. I mean, even just looking at the HIV field, we still have that discrimination and stigma, even though we're, they're years ahead of Hep B in terms of advocacy, I think. So one of the ways we're trying to go about it is help the community help itself. And to do that, I established hepbcommunity.org, which is this online forum for people with Hep B to connect with each other, to basically do that storytelling with each other on a smaller scale in terms of telling their stories just in text without dramatic music, of course, and the production that goes on behind that, but still it is there for people not to feel alone. What's also important is that we link, we have verified scientific and health experts on there to provide accurate information. If you do a Google search of hepatitis B and try to get information, you get millions of pages. And so knowing that your source of information comes from somewhere trustworthy really does help. We've also really partnered up with a lot of people, and we're really thankful for that support around. So this resource we think is a win-win-win for all communities. So the affected community, obviously, they get access to expert advice and know that others share those same experiences. What it also does is it allows people to circumvent or avoid that stigma by connecting with people in an anonymous way. People have their handles or pseudonyms. They can talk about things really freely. And so I guess there's less emphasis on this forum ending stigma in community, but I think it's basically a stopgap solution, allowing people to feel safety and discuss those things right away, right now. It also helps health professionals, we think. People share their stories and share their concerns, and also the misinformation they have in their minds. And so I think it's worthwhile for health professionals to be quite aware of these because they can stop access to care and they can alter their approaches accordingly. And they can know that there is that patient support out of consult and perhaps refer people to it. It also helps researchers in the field. It helps them understand issues that patients are facing and therefore require addressing. And this can lead to new research directions. And it also allows us to advertise studies and recruit participants. I'm working with Carla at the moment in a project about this at the moment. And so what we think is this community is a way to open up those discussions and get that connection. So there is less of that isolation and more linkage to engagement. So over the last 2 years, we've supported over 1,000 members from around the world. There's 5,000 posts and over 500,000 page views. We've got an on-demand, basically conversations with experts in various fields. And we've been able to run a research showcase where people from the scientific community show, what's happening, like cutting-edge research in the field, and showing the community that they're not alone, that there's this huge amount of work of scientific research going on behind the scenes, helping them out. And so what we're hoping to do in the future is continue to build that awareness and grow that community, because we do see real value in it. And hopefully supporting multiple languages as well in time as we grow and have those people from those different communities come. The second way we're going about it is building up that advocacy to change the conversation and to change things. So this is a newly established and incorporated not-for-profit called Hep B Voices Australia. And the central goal is to show that people with Hep B are the experts just by virtue of their experiences and are really central to the response. And we're trying to basically accumulate that response into a central area so it's way more productive and effective. So how will we make change? Basically using that maxim, nothing about us without us. So we're hoping to provide advocacy and help in that policy development by providing the affected community perspective on things. we're hoping to amplify voices and make sure that they're heard. So having Hep B doesn't automatically imbue you with the ability to share your story. So we're hoping to train up the Hep B affected community to be more effective in sharing those stories. And we think that's really important because then they have more impact. We're ensuring that engagement is with community and not only individuals. So you can call up people like myself to be representative of the affected community, but I speak fluent English. I'm embedded in the medical space. I have 15 years of molecular Hep B experience. I don't represent your average person with Hep B. So it's really important that we get all of those voices together to show that there's this diversity, and so that we don't leave people behind. And we're doing that so that we become this one-stop shop. Basically, if you need consultancy, if you need that perspective, we can get it to you. So we're funneling those stories together and being able to share them in the diversity that they are in. And we're hoping to march as one with the sector, obviously engaging with various partners in the space sector, but also with various communities within Australia and the region. So these are our values. We really want to centralize that lived experience because that is where we're strong. But also, as I said before, looking at that equity and diversity and collaborating with people, respecting all of those various viewpoints and making sure that everything's done in the open, because that trust from the community is just so important. We need to be clear about all of those relationships and how we work, because once we lose that trust, we lose our power. So this is our board at the moment, all composed of people living with Hep B. I think that's really important, that the affected community is the leader in this space because that imbues it with that trust and that background of understanding those issues. So yeah. So this is quite a new group where we're launching on the 10th of November. And if you have any questions, please email me after this. So the sort of theme or work framework that I have in mind is that these are two complementary things. Hep B being a shield and a Hep B community being a shield, and Hep B voices being the sword to change things. So how I see Hep B community is protecting and supporting the community now and informing for that safety and survival. And the idea is that you can only effectively advocate and make change if you feel safe and have the numbers. And once we do that, we can then make change by activating and developing the community, focusing on what should be and what should change. And because we can't just sit back and expect that change. As Chari said, this has to be an active process. And third of all is partnership with everyone you can. There's so much out there that stuff that's going out there. And I'm really, really heartened to see the sort of positive vibes that are coming out of this community. So I think I'll leave it there and thank everyone on this slide, obviously, and hopefully take any questions. Thanks.
Great, and congratulations, Thomas, to you and the rest of the board. Can't wait to see the launch, and we're using this forum obviously to amplify that message and I love that metaphorical image of the sword and the shield. Let's use that metaphorical sword. We're not actually going to use a sword on anybody, but to cut through the stigma, right?
Yeah, we might get banned from Parliament House.
Not even a foam stigma, a foam sword. Don't even take like a play sword. Terrific. Yeah. What great work both internationally with the foundation and work here in Australia. Have we got some questions or comments that people want to put into the discussion? I can't see anything in the chat yet. Multiple languages support from Yasmin. Sorry, Yasmin.
Can I make a quick comment? Yeah. So in the foundation, we do, as Chari said, a lot of work on the ground with people living with hepatitis B, and we also do a lot of studies and surveys to collect the voices of people living with hepatitis B, document their experiences, physical, emotional impact, and societal impact of living with hepatitis B. And we bring that out to the community and to the body of literature. But what I really like about the hepbcommunity.org is you can get all of this information in a very organic way, live, whether you're conducting research or not, whether you are part of a large organization or a smaller organization across the globe. Once you're on that space, you get that information. Physicians can, or clinicians can, without spending a lot of time reading, can interact with people living with hepatitis B and understand the non-clinical scope and the health-related social needs and the really human aspect of living with hepatitis B, aside from the lab work and the imaging and all of that. So I really think, and I always make sure to go there and kind of peek and see. And I send people there too. All my email responses has please go and join.
Great. So we do have a couple of questions coming through. So as I said, in the chat or put your hand up via the reactions button. So Lauren Brenner from our centre asking, what can researchers do to support or complement these fantastic organisations?
Could I go?
Thomas, you go first.
Yeah. I mean, we have plenty of researchers on hepbcommunity.org. We're really always looking for people to come on and really see what the affected community is doing and what they're concerned about, because we think that is really important to inform future research so that it is impactful, it'll make a difference to the affected community's lives. That I think is the major thing that people could do.
Yeah, I agree. And I think just to add on, there's a couple things. One is to listen. So we, at the International HBV meeting, which is, 600 basic scientists get together, we do a community forum at the end where people with lived experience come and talk about their lived experience. And out of, the 480 people that were there this year or whatever, maybe 50 stayed. And so I will say, one is listen. When you have a chance to listen to people with lived experience, and we can help you, Thomas can, we can put together sessions where we can get together a panel of patients. So people living with hepatitis B are always happy to share. And I will say, the scientists that stayed in the room to learn from the panelists came up to me afterwards and told me how impactful it was, because it helps you figure out, it really helps you ground why you're doing what you're doing every day. Because it's so empowering to hear from people who have lived experience. And the other thing I would say is, as a researcher, to see yourself as an advocate. It's not only people, when we have policy initiatives and advocacy initiatives, and we may need to make policy changes and we need to be loud, it's not just people who live with Hep B that need to be loud. The clinicians, the researchers, family members, we really need everyone to see themselves as advocates.
Yeah, and yeah, that definitely is a great point, Chari, is make space at the table for the affected community in all of those decisions that affect the community.
So another question about multilingual support from Barbara Louisi. Barbara, would you like to come on and ask that question yourself? Make sure it gets asked in the right way.
Of course. Sorry, I'll just turn on my camera. There we go. I'm not sure if you can see me. Hi, everyone. So I guess I'm just really interested in this idea of multilingual support for individuals and communities affected by chronic hepatitis B. And so I guess my question is, what sort of, when we're talking about support, what sort of support would be most useful, you know, along the journey, and what would really make a difference to the experience, not just of individuals, but also of communities in terms of their health journey, but also perhaps the journey around stigma and discrimination?
Chari, you're muted, I think.
Oh, I was just saying, great question. Yasmin, do you want to go first?
No,
I can answer part of the question that I got from the chat box. I mean, at the Hepatitis B Foundation, we have many different chapters. Chari, is it 14 or 16 language? I think it's about this number, and they are often visited, and they have a lot of information about hepatitis B transmission prevention, and they are very often visited. And to our surprise, for example, among the languages that are top and highly visited, the Spanish language, for example, although, I mean, and from an epidemiology point of view, it's not like the heavy burden of disease in Spanish-speaking countries, but people need information, and just providing this information in their own language, or the language that they understand, makes a huge difference in them understanding the disease, understanding how to communicate things with their maybe families and communities, understand even the basics, and be able to communicate with their healthcare providers and communities.
Mm-hmm.
I'd also like to add that I don't think it's only that having it in another language that's important. I think it's actually more important that the advice comes from someone who understands the background and realizes. So someone who doesn't understand the migrant experience or the understanding of the culture I'm in, coming in and saying, oh, it'll be fine, you just have to be open about it and blah, blah, blah. That does not fill me with a lot of confidence, you know. So I think any advice and information that has to come from that background of understanding where that affected community comes from and is experiencing at that time.
So
Okay.
Thomas, that's exactly right. I think what we find that works in communities is working with lay leaders and lay health educators and community experts from the community and helping them, train the trainer things. Like, so helping folks in the community who want to be a Hep B leader, and helping them become sort of a patient navigator informally, or an educator where they can then host story circles in their own church or in their own community center, things like that, like having it come from within the community. And we have resources in multiple languages for those kinds of trainings, and we're building some more actually. But Thomas is right, that's why we don't go in and educate. We have multilingual staff. We don't typically go in and educate in communities. It needs to come from the community itself.
Thank you. So essentially, so if I'm capturing this right, so the suggestions have been something about ensuring that the right information is available in the right languages, so it's easy to read, it's accessible, it's easy to obtain. So that's one dimension. The other dimension is really around cultural competence and awareness of clinicians and people who work in this space. And I'm just thinking of, coming from an Australian context, it's great when you can have clinicians of same or similar background, but that's not always feasible. So it's really about enhancing the cultural competence and the understanding of working within, different cultural spaces. And then the other part of that is really embracing that community development and community engagement approach, so that it's really coming from the community sort of, and it's the actions are coming from the community. Is that what I'm hearing? Great. Thanks so much, everyone. Sorry to take up your time.
No, thank you, Barbara. Fantastic. And we've got Kate Pinnock, who's runs Jailbreak Radio, a fantastic health promotion resource going into prisons, I think, across Australia now, Kate, offering to connect and network. Did you want to say anything else about that, Kate?
Hi, everyone. Thank you for that, Carla. Yes, Jailbreak is a sort of platform for the sort of work that you do in narration and health promotion. It's sort of exactly what the Jailbreak Health Project does. Obviously working with a community who are affected by incarceration. And I'd just like to congratulate the researchers and the work that you've been doing. I think I'm a great believer in narration in many different things, not just hepatitis C, but in many different aspects of life. And basically it's what Jailbreak's all about. It's all about sharing stories, but we are funded by New South Wales Health to provide a harm minimisation hepatitis brief. So thank you, Carla, for letting me just connect with everyone and offer sort of, I'm keen to partner with anyone who produces audio, and that audio, by the way, was amazing. Thank you. The stories were wonderful. And that sort of thing we could definitely share. And, you know, that's the sort of thing that Jailbreak produces as well. Yeah, so I'd love to collaborate with anyone that's interested, or if you want to share your work and extend the reach of your work, Jailbreak's where you come to, and I've given you my email address on the chat session. Yeah, so fantastic work. I totally agree with what everyone says. I'm a true believer of using the power of stories to educate, support other people. And yeah, it's great. Thank you. Thanks for that, Carla.
Thanks, Kate. So Jack Wallace is around, and you know, a great resource and expert on Hep B social research. Jack, did you want to ask your question? If you're able to tune in, there you are.
Oh, I'm hiding out in the bloody burbs. G'day, Chari. Good to see you. And fantastic presentation. I just think there's so many kind of different aspects to the kind of development of stigma. And one of them for me is around the kind of really bad testing processes, or how people are diagnosed. So that Hep B not only becomes, you know, a health issue, but it becomes really scary. You know, it becomes something to be absolutely afraid of, you know, within your kind of social and familial context. So I was just kind of like, one of my kind of bugbears is the fact that so many people get diagnosed or find out that they've got hepatitis B through non-healthcare services. And even healthcare services can be terrible at kind of providing information. But, you know, when you're kind of being diagnosed or being told that you've got Hep B by a teacher or by a, you know, HR person, it's kind of like, you know, you're pushing stuff uphill. So I was kind of, and we don't do, you know, with HIV, we were really clear about the importance of being diagnosed properly and in ways that supported you negotiating your life living with a virus. And Hep B, we don't seem to have that. And it'd be really lovely to be able to reframe that. Listen, and I was also thinking, as a person who lived with Hep C for a long time, you know, with medical, you know, when you go to see medical professionals, it was all about your liver, it was all about the virus. For me, as a person with Hep C, most of my life wasn't about, you know, most of my experience of Hep C was actually around stigma and negotiating, you know, negotiating the world and working out who I could disclose to and blah, blah, blah. You know, it wasn't a physical kind of problem. Yeah, sorry, I've just gone on a tangent. That's why I shouldn't go on the screen. It's really lovely to see you all.
No, we love to have you on the screen. So, you know, the site of diagnosis in those non-healthcare environments, perhaps, if we call them that. What do we do about that? What's the flow on and follow on from those kinds of, perhaps less than optimal experiences?
Yeah, well, that's where the policy change comes in. The reason people are being tested at university or at their place of employment is so that they can be fired if they test positive for hepatitis B. I mean, let's face it, it's being used to weed people out. And that's it. I completely agree with you, Jack. It's so stigmatizing and can result in discrimination. And it sends the message that this is something bad. You don't want to have this. You don't want to get tested. I mean, we hear people who come to us and tell us they have someone else get tested for them, or they will specifically not go to a certain place because they know they'll be tested. I mean, it is really terrible in many places around the world. And this is where we need to focus some of our policy change. And it is so challenging, although we have the experience from the HIV community and to some extent the Hep C community. I don't know, Jack, why Hep B is treated so differently. It makes no sense to me, especially since it's vaccine preventable and it's really not, transmission-wise is no different. I think this is where some information is worse than no information, because workplaces, universities, healthcare institutions, they seem to be so scared of Hep B, but not of any of these other infections because they just don't know enough. They know just enough to be dangerous. But yeah, this is where I think we need some systemic policy change.
I mean, partly also it's us as biomedical researchers' fault by, writing in the first paragraph of every paper that Hep B causes this many deaths and is the most infectious of blood-borne virus and that sort of thing. Regarding getting information, I think most people, after they get diagnosed, will try to Google it. And that is the main reason I started hepbcommunity.org, because the stuff that was coming up was, a lot of it was rubbish. And you try to do it in Facebook and you get a lot of people trying to sell you stuff that will, in worst cases, rot your liver because they're hepatotoxic. So that's exactly the reason why we have set that up, and we refer people to a lot of the resources that Hep B Foundation has set up, because we know it's from a trustworthy source and all that sort of thing. So it's really helpful in that space.
So we've got 3 minutes left, and I want to share 2 slides before we finish, but there's a specific question from Amber about using HBIG as post-exposure prophylaxis in conjunction with Hep B vaccine. That if anyone has an answer to that, that would be useful. And there's a great comment from Abel about from looking at this from the perspective of people who inject drugs. So if anyone wants to comment on that in the chat too. But is there any response to Amber's comment about HBIG?
Amber, we could talk more if you want offline. Feel free to email me. I mean, in the US and many countries, HBIG in some countries is really just used for perinatal transmission. In the case of a mother who has hepatitis B, it's part of the post-exposure prophylaxis. Or in the US, it can also be used as post-exposure prophylaxis if a person who is exposed to blood is unvaccinated and the person whose blood they were exposed to is known to have hepatitis B. It's really not used outside of that very much, at least in the US. I don't know about the rest of the world. I know in some places it's actually used inappropriately, and in some places it's so expensive they don't even have access to it.
Great, thank you. I mean, this is a fantastic session, and every session we know there's so much more to unpack and go into. So I really want to thank Chari, Yasmin and Thomas for taking your time, and particularly eating into the East Coast US evening hours to be here for us tonight. Really appreciate that. And I've got 2 things I want to say and put on the screen if I'm sharing properly. I don't know, I never know when I'm sharing things. But particularly, have I got a screen up there? Yeah. Okay. So we are running a short course in stigma reduction in healthcare. Hopefully the QR box is showing up there. Am I getting that right? If not, I can put it.
Yeah, it's a QR code. Yep.
There's a QR code, so please scan on that if you want to find out more about it. And we're just launching a new project that's been funded by our Commonwealth Government on a stigma reduction program, which I'm not going to have time to talk about, but I'm going to put the link to the paper, which is open access, in the chat, which is a new idea of universal precautions approach to stigma, knowing that there's many different things that people are concerned about in their lives, and as health settings we should be asking people to treat everyone with respect, regardless of how they're presenting or what they're presenting with. So thank you very much, everyone. It's just clicked over the hour. Really, again, great thanks to Chari, Yasmin and Thomas for your time today. Hope you enjoy the rest of the day or the evening, wherever you might be.